Who side over there? unless he gets.
Please continue to get connected for those who want to get started. The House and the Senate caucus first thing in the morning is our privilege to have some members here, so we want to get started on respect time. Thank you all for coming. I'm David Goldberg. I'm now chair of the Hospital Association. I also serve on my day job as president and CEO of Line Health and Data Center, executive vice president of Vandalia Health. We want to welcome everyone to Hospital Day here at the Legislature and the Legislative Breakfast. Before I get started formally, we have senators and delegates, Secretary Warner just left. Will members of the legislature that are here, please stand if you're not standing already, be recognized. Thank you for your partnership. Thank you for being here. Let's get and not to call him out late, the delegate Robach is running in now, so we can all do with him. But we appreciate it. Legislative session is in full swing. This is an important opportunity for our hospitals to continue to work collaboratively with our legislators to help shape policy and that positively impact the patients and the communities they serve. I want to recognize Karen Bowling, my vice chair and previous chair of the Legislative Committee, as well as all the members of the Legislative Committee, for their steadfast work in making sure that we are being proactive and collaborative on policies that affect our business, but more importantly, the people that we take care of around the state. So to Karen and our Legislative Committee, thank you very much for all the great work you do. As we find every year, there's no shortage of issues at the legislature. For our hospital members, you'll find advocacy materials sitting there at your desk and your tables. Please take a look at them as you're meeting with members of your delegations today and the key bills that we're tracking. Please keep this and other policy information on hand. And you can also scan the QR code on the back of your name tag to access legislative resources. Our advocacy efforts are critically important. West Virginia hospitals are caring for more patients than ever, sicker than ever, more complex than ever, and we're facing significant headwinds, as many know. Federal policy uncertainty around Medicaid, rising costs of labor, drugs, and supplies, mounting administrative burdens, and much, much more. Despite these obstacles, we know our hospitals remain steadfast in their mission to provide quality care 24 hours a day, 7 days a week, every day of the year. For our legislative friends in the room, your continued partnership this session and beyond can ensure we have the resources to sustain that commitment for the long term. We value the thoughtful work you do on behalf of the people of West Virginia. We stand ready to serve as a resource, answer questions, and collaborate on practical solutions that promote the stability of our healthcare system, reduce barriers to care, and support the workforce our communities rely on every day. This morning, we're pleased to be joined by 4 in particular leaders and friends. We have Senate Finance Committee Chair Jason Barrett, and I can't help but shout out his lovely daughter, Vandalia. Speaker Pro Tem and Deputy Speaker Dr. Mont Robach, thank you. Senate Health Committee Chair Brian Helton, and House Health Committee Chair Evan Worrell. They'll discuss major issues they're working on this session, from the budget and economic development to healthcare and other legislative priorities making their way through the process. Our speakers and all of our legislators work hard every day to make West Virginia a better place to work, live, raise a family, and to make us more healthy. We're grateful to them for always considering the importance of hospitals to the communities we serve. We are 54,000 strong and contribute more than $16 billion to the state economy. That's what conversations like today are so valuable. Thank you for being with us this morning. And now I'll turn things over to Jim Kaufman, the Hospital Association's President and CEO, to introduce our speakers. Thank you.
Good morning. First of all, I just want to thank all of our hospital leaders for taking time out of your busy day, taking care of your community, to come advocate for hospitals across the state. In addition, I'd like to recognize our board for all of your great work in leadership and setting the parameters. And one of the things that's often noted, I hear from legislators all the time that all they hear is hospitals that compete. And the one thing they don't realize is how much we actually work together, collaboratively, sharing best practices, sharing information to improve the quality of care and access all across the state. Earlier this week, we had a great op-ed by Doug Benz, the chair of our quality committee, that really highlighted our collaborative effort on quality of care And that has resonated very, very well across the hall with the chambers, both senators and delegates recognizing we do work together. We are improving the quality of care across the state. And that is a special thank you for all of your efforts in doing that. So this morning, our game plan is we have, as you heard from David Goldberg, the chairman of our board, which we appreciate your leadership. We have 4 great speakers. So our goal is this morning is we have House and Senate leadership that's going to talk a little bit about their broader agenda of how they're driving driving economic policy to make West Virginia a better place to live, work, and raise a family. So first, our first speaker is Speaker Pro Tem, Deputy Speaker Matt Warball. Delegate Warball represents Cabell County. In addition to being a member of the House of Delegates, is a full-time position in Huntington. So please join me in welcoming Delegate Warball.
Good morning. Couldn't be happier to be here. Before we start on the economy, I'll just say a few words about my journey in medicine. I was sitting with a group of medical students from WVU this week, as I do every year. I bring medical students by, and I said, 42 years ago now, I was one of those students doing a senior rotation down at Marshall. Medicine's changed a lot, and I see the leaders in medicine in the state of West Virginia here. But a lot of things changed, but the core hasn't. When I look around this room, besides my friends in healthcare, what do I see? I see people that have donated to our communities. You've worked hard in our communities. You've developed our hospitals, our healthcare systems, and you've done it all with the patient in mind. That's the one thing that I look back over my 42 years in clinical medicine has not changed, and I hope it never does. A lot of things have changed, payers and all that. We can go through all of that, and I've certainly lived through a lot of it. But the core values of medicine have not changed, and I implore you, as long as I see the good people in this room, they will not change. So with that being said, I'm going to give you a little bit about where at least the House of Delegates is headed this session. We've had a good session so far. We're halfway through. We made a conscious decision. Roger and I did sit in the office last fall that we needed to push an agenda that was all about the economy of this state. And we capitalized on the strengths of this state. What are the strengths of this state? Energy. Pure and simple. We are an energy state. I don't run from it. I'm proud of it. So we have an aggressive agenda, and I will show this is our 17 core bills right here. And that's what we're going to use to drive the economy of this state forward. Now, I will guarantee each and every person in this room, no matter what part of this state you're from, a better economy will help every healthcare provider, every hospital in this state. We are committed to driving the economy of this state forward, period, in the discussion. How are we going to do that? We produce a lot of energy in this state. A lot of these 17 bills that you're going to see, and most of them have already moved through a committee and across the floor in one chamber. But what those bills are all about is getting the industry here that uses that energy to get the jobs, get the tax base, rebuild the population of this state. Because I know one thing that I'll guarantee you, I'll speak for every hospital administrator in this room, a better payer mix would help each and every one of you. And I see a lot of heads on it. So this is an unarguable position that we want to drive the economy of this state of West Virginia forward. And these 17 core bills about rebuilding our workforce, retraining our workforce, repopulating, getting people to come back to West Virginia, using our energy here, what businesses fit in the state of West Virginia, and how can we get it here? We've got an aggressive lean into aviation. I think we're going to have a big announcement there soon. But it's all about rebuilding the economy of this state to help each and every person in this room. So that's what the House of Delegates has been moving aggressively towards this session, and will continue to move that direction, because without it, none of us are going to do well. But we have got to move in a direction that's positive, because I do know this: a lot of the problems with healthcare and a lot of the social problems we see in this state, a better economy will help fix each and every one. So with that being said, I thank each and every one of you for your contributions to the state of West Virginia. It's the largest industry in the state of West Virginia, employs the most people. I've been a beneficiary of that for 22 years now. I thank you for what's going on in the state of West Virginia in healthcare, and I look forward to us working collaboratively to continue to move that forward. So Jim, I'll turn it back to you.
Next is Senator Jason Baird. Senator Baird is the chairman of the Senate Finance Committee. In addition, he represents Berkeley and Jefferson counties and is a small business owner. Mr. Chairman?
Good morning, and Jim, thank you so much for this opportunity. As David pointed out, my daughter's name is Vandalia, and our son's name is Berkeley, so I don't want it to be lost on anyone in this room that both of our children are named after hospitals in this state. If you believe that, I'll tell you a couple more. But on a very serious note and a sad note, I do want to start my remarks today on a sad note. And for those of you that don't know, our Senate President lost his sister yesterday. And I would just ask that each of you keep him in your prayers. Keep that in mind as you see and interact with the president over the next couple of days. And Randy, above everything else, is a family man. Those that know Randy know that. And I know his family has dinner together every Sunday. He enjoys time with his family, especially wrestling with his grandkids. So this is a difficult time for him. And I just ask that you have your prayers and thoughts with him at least over the next several days. And when the president asked me to take this job now 2 years ago, I wanted to make sure that when I agreed to do this, that I would have the ability to do the job without being micromanaged. And I will give the president credit. His style is one in which he trusts the people that he puts in positions. And that style, I think, serves the Senate extremely well. It serves the committee chairman extremely well. And as you know, I served 8 years in the House, 6 of those years on the Finance Committee with a couple of different chairmen. And we sat through, as you all know, about 30 days of budget hearings every year in the respective finance committees. And I remember one year after sitting through 30 days of these budget hearings, it was time to start to put the budget together. And I was just rank and file member on House Finance. And I went to the chairman and said, you need to have a caucus of just finance committee members, and you need to hear our feedback on some of what the budget priorities are, things that are important to us, how you prioritize some of the spending. And I won't tell you who the chairman was, but his response was, well, this is the finance committee, not the budget committee. And I quickly reminded him that I sat through 30 days of budget hearings, and I wanted my opportunity to voice my opinion. And so at that point, I realized if I ever became finance chairman, either in the House or the Senate, that I was going to do things a little differently. And I would have opened up to the committee because, again, they sit through those budget hearings. They ask the tough questions of all of our state agencies. And so I know that many of you have come and talked to me about different items, whether it be pieces of legislation or appropriations in the budget that cost money. And one of the first things I always ask you to do is go talk to other members of the committee, get their support. Because when I put the budget together and I decide what bills that we're going to run in committee that have a financial impact to the state, I want to make sure that the folks on that committee are supportive. And I want to give a shout out to at least 2 of them are here today, Senator Morris and Senator Queen, who really make my job a lot easier up there. They are outstanding members of that committee. They ask a lot of tough questions. They push on agencies to get the answers that we're seeking so that we get a complete understanding of why that particular agency has requested their budget. As it relates to bills that have a fiscal note that costs the state money, and that's what the fiscal note indicates. It's a tough job trying to prioritize that because in the Senate we have 34 different members, 34 personalities, And they represent folks all over the state. And so I have to prioritize those spending measures. And I'll tell you, as it relates to some health policy, when I get a bill from the health committee, I think it's important that you all understand so that you can effectively work with both the health and the finance committee. Is my primary role when I receive those bills. They've already come to the health committee. My job primarily is to look at the financial impact of those bills. And I would ask that, when you're looking to make changes, you have some feedback as it relates to the health policy. The first person you need to speak to is Senator Health, because when the bill comes to me, we're looking at the financial impact. We still have to get the votes out of the committee. Our members still have their input and their feelings on the health policy, but really the health policy needs to be taken care of as much as possible in the health committee. That doesn't mean it's something that's called out to the committee that we won't work on, because we certainly will. And again, we have 17 members of that committee that have opinions, but our primary focus again is on the fiscal impact. We have, again, a little bit back to the budget and some of the supplementals that we're going to run. Some of the costs and expenditures that we have in the state are great. And deferred maintenance is one of them. And you're sitting in a building right now that has more deferred maintenance than probably any state-owned building that we have. And the finance committee yesterday took a tour of that building. And I'm not a contractor, but I'd estimate there's probably $100 million in deferred maintenance in this building. What you see here today is the best part of this building. And so it's things like this. It's deferred maintenance in our higher education, it's deferred maintenance in our prisons and other buildings that, those are all things that we have to weigh when we're putting the budget together. Some of the largest drivers of spending in this state right now in our budget is the Hope Scholarship, as you all know, is Medicaid. And as I look to put this budget together, I think what you've seen, the introduced version shows a lot of the Medicaid money in the surplus section of the budget. We are looking probably to move a lot of that back to the front of the budget because it is a priority. It is base spending. It is going to be ongoing spending, and it is something that we have to prioritize in the state, and we will continue to do that. It's no secret that there has been a push for a large tax cut in West Virginia. And I'll tell you, the Senate is committed to trying to deliver the biggest tax cut to working people in West Virginia that we can afford. And that's the balance that we're contemplating right now, is what tax cut can we afford while being fiscally responsible and taking care of the important items that the people of West Virginia ask us to do. I can tell you, as it relates to higher ed, I have zero desire to cut one nickel from higher education. We talk about jobs a lot and opportunities and bringing companies here. And if you don't have people that can do the job, there's no sense in bringing the job here. And so we will continue to focus on higher education, K through 12 education in our state. And so those are priorities that the Senate has prioritized. Senate Bill 1 is the president's bill this year that deals with small business, giving small business the opportunity for a loan program to allow them to expand their business. I fully anticipate that our budget will provide resources for an Office of Entrepreneurship, which I know is incredibly important to Senator Queen. It's important to all of us in the Senate. You all I've talked to a lot of you all about the Rural Health Transformation Program. And as you know, that supplemental is up on the Senate floor in the next couple of days. We ran out of committee a couple of days ago, which, as you know, is $200 million. $200 million each of the next 5 years. It's $1 billion to transform the overall health of West Virginians. And $1 billion is a lot of money. But this is also an awesome task that we have that is not only on the folks in that building, but very much on the folks in this building, and providers, folks in the healthcare industry all over the state. And we have 5 years to turn our health around. And I know that's not lost on anyone here. I hope it's not lost on anyone across this state, because if we don't, the key word in the Rural Health Transformation Program is transformation. And if we don't succeed in that transformation, we are going to have a huge fiscal problem in 5 years. And so I know everyone in this room and everyone in that building is committed to transforming the health of West Virginians. So I want to thank each and every one of you for the work that you do day in and day out We don't say thank you enough, but I want you to know that we do appreciate everything you do. You're involved, as Delegate Warbach said, involved in our communities beyond what some of us even know. And so you touch all of our families. We're incredibly appreciative of the work you do. And again, I just want to thank you for this opportunity as well.
We greatly appreciate Delegate Warbach and Chairman Barrett joining us this morning, because as economic opportunities are across the state, people forget hospitals are economic engines in your community. We directly account for $17 billion in economic opportunity. We also account for 53,000 jobs directly. And one of the things when we talk to legislators about all the time and effort that they're working on bringing additional jobs to the state, that is absolutely critical for us, because it does, as Delegate Warbach noted, improve our payer mix. But also we forget to note that we have 4,000 jobs just in a few job categories that we can fill. So we actually have a great opportunity to help grow the economy ourselves by filling and growing more jobs. So now that we're going to shift a little bit from broader economic policy and other efforts across the state, we want to dive deeper into health policy. So our goal now is to have the two health chairs come up and talk a little bit about their agenda for the rest of the session, as well as, if time permits at the end, we'll open it up for questions at the end. So first, I'd like to welcome Chairman Brian Helton to the podium. Senator Helton is a businessman representing Wyoming and Raleigh counties. This is his first year serving as the chairman of the Senate Health Committee. So please join me in welcoming Chairman Helton.
He's a little bit taller than me.
Hey guys, it is truly my honor to be here today with all of you, because when you think about the Hospital Association and you look across all of our communities in West Virginia, you guys really are the anchors in our communities. And in most counties across the state, if not all, the largest employer. And not only are you the providers, but in many cases the first responders, first people little leagues come to when they want support. Just do a tremendous job. And I've had the opportunity this past year to visit several hospitals and lots of care providers of various types, and it's just been a great experience for me. And so I just want to talk about a couple of people here today. First of all, a lifelong friend of mine is Karen Bolden, and I coached high school basketball for 21 years, and two of her nephews play for me, and she's the best aunt I've ever had. So we've been great, and she's been really helpful in helping me form some of my ideas on what we're going to do with our health committee. Jim's been fantastic to work with. He's been tremendous. David Goldberg gave me front row seats at the event in Morgantown, and he's been great all the way. AJ, him and set me up a lot of visits. We've been able to go to together. Danielle Waltz is great to work with every day at the Capitol. And so I feel like we have a great team in place, and we can really get some things moving. Of course, I got to talk about the guy that's going to make Raleigh General Hospital great again, and that's David Brash from my home county. So let's give David a big hand since he's from But healthcare in West Virginia, we have the largest number of chronic disease issues. We're worse in the nation when it comes to substance use disorder. And so I realize that, as Jim just mentioned, I realize too, we're short 4,000 people that we wish we had here to participate in our workforce. So one of the things, when I had 24-hour notice that I would be in charge of the health committee this year. And so there was a lot of hard work by a lot of other senators that went into many of the bills we had this year. And so I get the opportunity now to decide to run those bills and figure out which ones really make sense for West Virginia. And as we sort of went through that, I kind of set this up into the biggest areas of opportunity that we have in our state. And I think we'd all agree, number one is our CPS and our Department of Human Services issues right now. We're number one in the nation of children being taken from the home. Number one in the nation of neonatal abstinence syndrome. We have some of the lowest birth weights, and I didn't say rates, birth weights in the nation. And we really have to get things under control. So we focused our first 2 weeks working. We just kind of moved all the bills over to the side, started working on these CPS related issues. And so one of the first things that's happened is we really focused on kinship payments, because we have so many grandparents and kinfolk that end up having to take care of these children. And right now, there was a big delay. They had to go through a big certification process. In a lot of cases, they weren't prepared. And so we wanted to get them that stipend money quickly so that they can start taking care of these children. We worked on clothing vouchers that'll get the children 7 days worth of clothes, because in many cases, they're swept out of the home and with nothing to go with them, maybe just a few belongings. We wanted to get them up to that speed as well. And again, these aren't my bills. These are bills other senators put together. But as I looked at them, I thought, that's great. Let's do that. We also felt like it's important to get a little more transparency. So we had legislation already this year where we're going to give LACRA a little more oversight into what's going on. And then also, I think an important bill we focused on was to make the policies of the department become legislative rules so that we have a little more oversight. And more importantly, we give the public 30 days to comment on a lot of those rules. Secondly, our substance use disorder issue is just killing our state. We could probably fill these 4,000 workers if we get a workforce participation up, but our substance use disorder is playing a major part in our demise when it comes to not only being number one in overdose rate and all these other problems we have going on, but also workforce participation. And we also realize that plays in large part to your payer mix. And when you're trying to be profitable and provide good health care, I fully understand it's a huge challenge when you're dealing with the payer mix that we're up against right now. And I think the substance use disorder, if we can get our drug treatment programs better, then we can start seeing that turn around as well. And so we've passed a piece of legislation this year that will focus on that becoming more outcome based. And so we want to pay more money to providers in that space that do a great job. We want to pay less money to providers who just can't seem to get it done. And we work closely this past off season. I think we had maybe half a dozen meetings with hundreds of cohorts to talk about how do we come up with legislation that really helps us make sense. And so I think we have a good bill that the Hospital Association was behind and endorses to help move our state forward when it comes to substance use disorder. And then lastly, but not any less important, we decided today with Hospital Day to really start focusing on the needs of our hospitals and how we can help you guys do a better job serving our patients across the state. I think right now we're doing a great job, but we really want to position you guys to be able to take better care of patients without unnecessary delays and to be able to move the ball. So we've got 3 bills today. I invite y'all to my committee. It won't fit, it's such a small committee, but we're going to run some important bills today that deal with involuntary commitments when it comes to substance use disorder or general mental health issues. Right now, 24 hours, I think we all agree, is not enough time, particularly when we have part-time mental hygienists. We have weekends that happen every week, by the way. And so sometimes I realize you guys are caught really between a rock and a hard place. And we've got people right now, we're number one nation with mental health disorders, and you guys deal with that more than anybody. So we want to remove that burden if we can all possible. I think it's a great bill. We also have a pilot program bill running today that seemed to work really well in Cabell County, a couple other counties. We're going to try to expand that for you and add, I think, 4 counties to it. By the way, Raleigh County wasn't in there, but magically enough, it'll be amended into the bill. Let's make sure we send this back home so everybody sees we said that, right? So that'll be a good bill where we're really trying to reduce for you and put in these pilot programs to help you have less involuntary commitments, because we know that's not good for our healthcare system anyway. So we want to look for ways to cut that number down. And also, Chairman Worrell and I have worked great together. He passed, I think, an important piece of legislation, which is talking about our Medicare credentialing or Medicaid credentialing. And it's a good bill that's going to not leave you guys on the hook for so long. Hopefully we can speed up the process so we're not hanging out here in perpetuity, and we can get this stuff moving quicker for you so that we can provide the best patient care and allow the providers to really be successful. And then a bill we worked hard on And I'll give Senator Queen all the credit for this, and he worked hard in the off-season with this bill. And we actually, thanks to David Goldberg and AJ Hammond, we said visit up, we were able to visit Highland Clarksburg and realize this unique challenges with that hospital. So we'll run that bill today to try to make that right, because we've got, what, 84 beds there?
85 today.
85, right? I was off by one, not too bad. So we want to help with that as well. So listen, my door's open. I'm in 439 M. I'd love to see as many of you today as possible. If we can't meet, leave your card and we'll catch back up. But I'd like to hear what's unique to your situation at your location, because I know everywhere's different. And I've been dropping names this whole time, so I have to say I'm a little tired today because I was with Donald Trump yesterday. But we're a group of us were able to go to the White House yesterday, and so that was the first time for me, and it was a really great experience. But also, it was related to energy, but everybody's talking about healthcare, and that was part of his speech last night. So I thought that was real appropriate as you come in the hospital today. So thank you guys so much. I appreciate it, and really look forward to working with each and every one of you. Thank you.
Next, we'd like to welcome Chairman Evan Morrell. Volume Morrell is a Barberville resident and served. This is his second year as chairman of the House Health and Human Resources Committee. So, Mr. Chairman.
Good morning, everyone. Thank you, Hospital Association. Appreciate the opportunity to come and speak before you all. And I want to say thank you to you all for your leadership right now in a very unique and extraordinary time. So I want to start with something very simple, and that is that when it comes to healthcare policy in West Virginia, it must be built on partnership and the people who deliver care, you all. So I want to make sure very clear that I want to work with you, not around you or over you. I'm blessed to have a lot of relationships with some people in this room that are welcome to my door every time, any day of the week. And I want to clarify that I want to work with you in that partnership, because in West Virginia, we know that healthcare is not just a service. You all know this. It's infrastructure. It's economic development. It's community stability. And right now, we know that infrastructure is under some pressure. And so when we talk about this federal uncertainty, I know that federal changes under one big beautiful bill created that uncertainty when it comes to Medicaid reductions, provider tax limitations, obviously, and direct payment programs, DPP programs. And this impacts us disproportionately, in my opinion, because as you all know, 3 out of 4 hospital patients are covered by some sort of government payer. And those payer mixes affect you all, and so that's why you guys are always vulnerable to these public policy shifts. But it means that our responsibility at state level is clear, and that is that we have to prioritize that stability when we can. We have to stabilize reimbursement, regulation, and obviously workforce policy. And so when we talk about that payer mix, I want to be clear about how we do that. And the Deputy Speaker, Delegate Rohrbach, already talked about it, and that's through workforce participation. We have one of the lowest workforce participation rates in the nation. And so we need more people working, and we need to make sure that they have jobs that offer employer-sponsored insurance, and that helps in increasing your payer coverage and commercial insurance, right? Right now, you all carry that heavy government load, as I talked about, when it comes to Medicare, Medicaid, and PIA, which is nearly double the national average. That's why it affects us so much differently in West Virginia. And if we want to strengthen hospital finances long-term, we have to grow the number of West Virginians participating in the workforce. And that's why I'm thankful that the House leadership is focused on a jobs-first opportunity everywhere platform. And that means expanding that economic opportunity, supporting that job training, reducing health barriers that keep people from working, and building that healthier population that's capable of that sustained employment with commercial insurance. That makes sure that rises, that uncompensated care declines, right? And you all have greater financial balance. So healthcare policy and workforce policy are deeply connected, and that means we have to focus on a stronger workforce. It means a stronger payer mix, which ultimately means stronger hospitals. Let me talk about something that's near and dear to my heart, is House Bill 4982, which is a little plug. It's on the Senator's Health Committee agenda today at 1 o'clock, so make sure you go up there. That is the Make West Virginia Healthy Act. And if we want more West Virginians in the workforce, we have to address the chronic disease that burdens and sidelines too many people. And so that idea is just very simple, but I think it's powerful. If we reduce preventable chronic disease, we increase workforce participation. And if we increase workforce participation, as I already said, we increase commercial coverage. And if we strengthen that commercial coverage, then we help stabilize our hospitals. And so it's not about expanding government. We just want to make sure that we empower families with better information, improve transparency, and address upstream contributors to that long-term illness. So I believe prevention is an economic policy issue, it's a workforce policy issue, and prevention is also a hospital sustainability issue. When fewer of our West Virginians suffer from that, uncontrolled diabetes, heart disease, obesity, metabolic illness, things that we are the worst in the nation at. They work more, they earn more, they carry commercial insurance, and they rely less on high cost and high acuity hospital services. So that's a win for you all as well on your balance sheets. And I want to call out somebody, and something I was able to do earlier this year as I traveled up to Rome General and what Doug Vince is doing up there at Rome with his gym and working with diagnosing metabolic syndrome and prescribing produce and things of that nature. I wanted to move to Spencer. It was pretty exciting to see what they're doing up at Rome General. And I'm sure all of you have specific programs you're doing. That was just one I was able to go up and see. And I was really excited about how we do this prevention. The way I think it looks from our patient standpoint is it's truly healthy care. It's not sick care. They're not coming to the hospital for sick care. They're coming for health care and improving their health conditions, their health outcomes, which ultimately I believe builds trust with our providers and with our provider relationships going forward. When they do truly need that specialized care, that they have that trust to come and see you all. And I think that ultimately improves, once again, that the balance sheet for the hospitals. But at the same time, we want to be clear that we do have to protect the tools that you rely on, right? 340B is very important. And so I've been very clear about 340B as a federal program. We want to do nothing at the state level to impact that, so we can get in the way of that. I appreciate what you all are doing in the community side. You all know that, so that's big. And so I want to make sure that you guys are doing a great job in your communities with those programs and seeing those federal savings, and we don't want to get in the way of that. But we do have to continue examining those regulatory burdens that pull that clinical staff away from patient care. That's important. So I want to be clear that if state rules duplicate those federal mandates and they don't improve outcomes, then we need to reconsider them. There needs to be less duplication and more delivery of care. And we talk about rural health transformation program. What an exciting time. I know we're going to see a lot of cuts from OVD, but the rural health transformation was a big deal. I applaud the governor and his staff in hiring McKinsey to go through the application process in such a short amount of time. I appreciate all of you who submitted proposals for the RCP program, very important role of that. And we had the highest per capita award throughout the country. But that is reevaluated every year, as all of you know. So you'll see some policy shifts that we're looking at in the legislature to help improve those scores, because as of October 31 of this year, that application was one time, but it will be reevaluated on some policy shifts that we take into account. So we can see an improvement in that $199.5 million we received for this year. And that's one of the things we're focused on. We watch those point systems, how we can change some of our policy shifts that make sense, realizing that we're not going to make all those changes, but where it makes sense, we will introduce policy shifts to increase that award going forward. And once again, as I think most of the speakers have talked about, that is about transformation. You all know this. We need you to help deliver this appropriately. And want to clarify how that works is it has to be done through being strategic and collaborative, because they have to be long-term delivery models with a 5-year program, right? So how can we be impactful and sustainable long-term with just 5 years of those funds? And we cannot do it without you all. So we're excited. I'm excited for that program. When it comes to the legislature, I think all we're doing is appropriating funds. But I do want to be very clear that as the chairman of House Health, and I know the chairman of Senate Health is still the same way on block, we're going to continue to ensure and watch those funds and make sure that they're being spent appropriately, and that we can ensure that we're partners in that program as well. But in closing, I do want to talk about why we are unique a little bit. You all know this. We're unique because of those public programs. And so we have to change population health, as I talked about workforce participation, growing commercial coverage. And these goals aren't separate. I mean, they're completely interconnected. And we can't talk about payer without talking about that chronic disease. We don't talk about stability without collaboration. So you all know that you have myself as a partner with you to work on this. And I'm so thankful for Jim Kaufman, Tony Gregory, Brandon Hatfield. I mean, we talk constantly about policy ideas and things that are going on. Did I say that right? Do I get paid now? No, I'm serious. Jim, Brandon, and Tony, we are in constant communication about things that are going on, even when we disagree. And that's healthy. I want to be clear. We have that healthy trust in each other, relationship where we can have disagreement conversations and understand each other's positions and why, and we move forward. And sometimes we compromise, sometimes we don't. And a lot of times we're lockstep in a lot of things that we're trying to do, because overall we all want the same thing, and that's to improve the health, the health of West Virginians. And so I'm very grateful for that. So I want to clarify that, once again, we want to make West Virginia healthy through these initiatives. We can't do it overnight. We can't do it in a year. but I am committed to taking those incremental steps. Like we talked about Medicaid credentialing, the Senator talked about. Nobody was out there clamoring for that to change, okay, to be honest, but I heard it was a problem. I heard it was an issue. So we brought together the providers, the NCOs, the enrollment provider, and we said, okay, all of you are going to have to do something a little different, but ultimately it improves access to care, it improves your doctor, your provider providing that care in a much timelier fashion. So I'm excited to see that go across the finish line, and I want to see how that plays out through the year. We may need to tweak that, maybe to tweak the full credentialing application, but I'm committed to doing that to ultimately improving that access to care. I cared greatly about that. Another one today, the senator talked about his committee meeting, 1 o'clock today. And said we are meeting at 3:30 today and on the House side. And we have a very diverse array of bills we're taking up today. Western Cares is an issue. We're going to try to tighten and streamline Western Cares for those who deal with Western Cares. We've seen that there are issues there. We're going to try to clean that up. We have PBM reform on the agenda today. Very important. We've done a lot of PBM reform through the years. We've been a leader in the country. It doesn't catch the headlines it's supposed to get, but we have been a leader in this country in PBM reform over the years, and we have some more on the agenda today that we're going to take up. And then we have some child care issues. We have some pesticide issues. My point in telling you these things is we, in Health and Human Resources, we cover a very diverse array of topics that we are trying to go through. We're trying to tackle the things that make it better for West Virginia. So I appreciate you and thank you for your leadership. I once again welcome your partnership and your collaboration. I want to hear your voices and hear how things affect you and how we can help improve the lives of West Virginians going forward. And my door is always open, as Jim knows that. So thank you, Dick, for the opportunity to come speak before you this morning. Appreciate it.
The two chairmen have agreed to open it up for questions, but the one thing I promised them is we would be done by 9 o'clock because they have other things to get to. So we're going to open up for any questions. If you would like to ask any other questions, just please raise your hand. And the one thing I do want to note is both have noted how they have an open door. They have been absolutely wonderful to work with. They've been very receptive to all of our issues, all of our conversations, and we've worked very, very closely with them on numerous pieces of legislation. The one thing I will also say is that we may not always agree on every issue, but it's always an open door, and they're willing to listen and talk and understand more. So I just want to recognize the two chairs for that. So with that, do we have any questions from the audience? While you're thinking of your questions, I do have a couple. Delegate Morale, you both alluded to the provider enrollment issue, and this is what we greatly appreciate. You heard from hospitals and the providers that the enrollment process has been very, very challenging. And Delegate Morale, you've been the lead sponsor on House Bill 4335. We really do appreciate it. Can you dive a little bit deeper into that and what you hope to get out of it and what we may need to address in the future? You started to allude to it, and I think it's done a little bit more.
Yeah, so the idea, I don't know if this is
Thank you very much. Yeah. Okay, there we go. Yeah, so on 4335, and that's already passed the House side, and already passed Senate Health, so appreciate that, Senator, for doing that. But that's important because we saw an issue, and you guys know this, right? We have providers out there taking sometimes up to 6 months before they can see a patient bill for patient services. That's unacceptable. When I heard about that last year, well, I think it was last September, an joint health interim meeting, brought Gainwell, the enrollment provider, to the table. Obviously brought the NCOs to the table as well as providers in hospitals and how we can make this change, how we can improve this. So the idea here right now is that we lowered the time frame from 90 to 60 days for the NCOs to credential. We also put a 5-day business day requirement on the enrollment provider, which is extremely important. And you might laugh, and that 5 days is no way. But I want to be clear. They spoke in front of the Joint Health Committee, and they said that it takes them 3 to 5 days to enroll a provider. There was I think there was some chuckles there when they said that, but they said it. They testified to it, so we made sure that we put it in legislation so that they can enroll providers quickly. But ultimately, you have to submit that uniform credentialing application electronically. That was one of the things they said. If you submit it electronically, they can turn this around much quicker. So that is also a requirement there. The one thing we want to focus on going forward is we really want 2 things to happen, but we couldn't do it this year because we need to see how this will affect. And that is that we need a true one form for credentialing and enrollment that will satisfy everyone's needs. So we will get there. That is my commitment to you on that. The other thing is the effective date. Right now, NCOs cannot backdate that effective date based on being NCQA qualified. We're going to find a way. We're going to partner together and collaborate to figure out how we can make that effective date more appropriate But those are two issues that we cannot address in this year's bill, but we will be increasing or improving that time that we can put our providers to work. And then we'll see how it is going. And as long as it's going how we expect it to, we'll tweak it going forward. But I think this is a step in the right direction. Karen bowling this, how I feel about this. We are trying to take incremental steps to improve access, improve these measures. We're not trying to take a huge bite of the apple. We're trying to take those smaller bites and try to make sure we're doing it the right way. And then as it works, then we'll tweak it to make it better. If it doesn't work, we'll go back and revisit it.
Mr. Chairman, I just gotta say thank you for your leadership on that, hearing our issues and the willingness to, we didn't get everything we wanted this year's bill, but your willingness to continue to work with us in the future. Senator Helton, last year when you first came to office, I remember you were very, very passionate about substance abuse programs and how to improve it. In fact, I can remember our first conversation was a 3-hour conversation starting about 6 o'clock at night about substance abuse. And then you wanted to dive deeper into it. I remember you met with Marshall Health, WVHA Medicine, and other providers all across the state over the past summer to really try to understand more about how to improve these programs. And you're very focused on value-based care and substance abuse programs, and that vision is encapsulated in Senate Bill 231. That bill is now moving. Can you talk a little bit more about what your vision is for that and what you expect to see in value-based care?
Yeah, sure. Yeah, thank you. Is that on? Good. Yeah. So the genesis of this bill is that when I decided to run for office, I'm a first-time politician, so I went out and started a campaign. Didn't know any other way to do it other than show up at chili nights and rent dinners, and so I had to change pant sizes a few times because I drove up and down the way going through all that. But one of the things I saw going across all of southern West Virginia, and of course I experienced this in running my own businesses, is the lack of workforce. And when you get out in the communities, it really hits home, and when you see the substance use disorder that's plaguing our communities. And it primarily used to be southern West Virginia was more than the rest of the state, but now it's really spread across our whole state. And I realize there's been some improvements in some of the metrics, but we still have such a long way to go. So the first part of the bill basically takes a look at a standardized billing code across Medicaid, across all of our programs to see how we're measured up within each provider for each service. And so the idea is let's see how that stacks up provider to provider and to be able to benchmark that and look for outliers in that process. The primary part of the bill is to focus on our outcomes. And so what we've done with this is set up a bill that doesn't have a couple of legislators sitting off in the corner figuring out what sobriety is, but it brings a group of people together, and named in the bill are WVHA Medicine, Marshall Health, the bureaus, all the departments, those in recovery, lots of behavioral health folks will be in that as well, to come up with the metrics that are measurable when it comes to sobriety, things like law enforcement contact, child CPS issues, failed drug screens, whatever those issues become. We've got about 5 or 6 in mind there that really would say, hey, this person's achieved sobriety. Track that through the process, and 2027 will be a baseline. So I'll back up a minute. So starting in July of 26, the group gets together and decides what the measurables will be, or what our benchmarks are. In 27, we'll run the program as a benchmark year. And then in 2028, the new payment model will start, and it will be value-based. So to make a long story short, we want the good providers that are really hitting these metrics to get paid more money. And we want the bad providers who can't hit the number to get paid less money. And then they will have a 3-quarter improvement period to try to get to that number. After 3 quarters, if they're not successful, then they would be under a Medicaid review for certification. So I think we can get to a good program. I can already tell you, in many of the hospitals here, and probably all of them, you're hitting these numbers. I see these wraparound services. I see these things that really push people into long-term recovery. I think we'd all agree that we have built this drug treatment program into a 28-day cycle, and we also feel helpless because that's what Medicaid will do right now. So we really want to drive that process. We're going to look in the future at possible ways to get our state in a position to provide long-term recovery and have that somehow through Medicaid with waivers. There's states that are working on that as well. I think we can get there. So that's the genesis of the bill, was just being out in the communities and seeing the need, and then meet with providers all across the state.
Thank you. Do you have any questions from the audience? If not, I have another question. Delegate Royal, you kind of alluded to the rural health transformation program and the challenges that we have as a state with, we lead in obesity rates, we lead in diabetes. And I just want to say thank you. When we spent the hour drive up to Rome General when you went to learn more about their prescription for your health, one of the things you talked about was your own fitness routine. And I have to admit, you lead by example when you're telling me about your workout routine. So it's a great leadership by example. But can you talk a little bit more about what you envision with wellness, the Rural Transformation Program, and while we're investing in wellness, recognize hospitals and physicians for a sick care system where we get paid to treat illness. How do you envision kind of that change to wellness in the future after the RHTP program expires?
Yeah, thank you. And then you're right. And I was really impressed when we did drive us. We had a great conversation and once again, calling out Doug for what he's doing in general. And, really impressed with that. I think he might have a money tree up there hiding somewhere. I don't know how he's paying for the program, but it's pretty amazing what he's doing. He's really transforming people's lives up there. So really impressed with that. But yeah, I mean, we all know there's no secret here. Prevention is key and prevention is cheaper. And as you know, we have a fiscal responsibility to the state as well. And so when I look at that, the prevention, what we're paying now and ER admissions, dialysis, things that on Medicaid, we can reduce that by changing the way that our citizens live. And when I say that, we're talking about optional services. We have food deserts throughout the state. People can't even access food. Dollar General's they're only access to food. But in multiple areas that I've traveled the state, I know there are local producers in the area, that local producers within people that they just don't know about. So part of that Make Western Healthy Act and that House Bill 492 is to ensure that Department of Ag is working with Department of Health and DMS to identify those local producers, to ensure that we can get local food out to people. And I think the hospital systems and our clinics are going to be help the drivers of that. I'm not speaking for you all, but with RHCP, I'd like to see that as a potential pathway where people are able to get prescriptions for produce and prescriptions for food and medically catered meals delivered to those houses. I operate in-home care facility or in-home care agency, about 500 Medicaid patients throughout the state. And you wouldn't believe some of the places that these people live and how rural they are. And getting to their homes and then getting out of their homes is very difficult. So with RHCP, I look at that connected care link where we're delivering mobile clinics and out into those smaller communities more often. You guys are already doing some of that already. I've talked to a national provider of medically tailored meals that FedEx is delivering straight to their home. Medically tailored meals, which is extremely important. So we have to start there to just try to change the trajectory in our age population with health, but then it's also about the next generation. Part of that bill also works with the Department of Education to improve healthier lifestyles, active lifestyles, nutrition. When we send our children to school every day with breakfast and lunch, they have no choice really of what they're consuming. So we have been a leader in the nation in banning food dyes, for example, last year in school lunches. It's important that we change the health of that, and part of that bill also works with local producers for our farm to school table food as well. So we're not only doing an economic driver in a local community, but we're also putting healthier food in front of our children. And I think that's paramount. What we want to do is properly educate and inform the school-age children so that about healthier lifestyles and nutritious meals, so that when they become adults, they are also making those healthier choices as adults as well. I want to be clear about them making choices. I'm trying to take away or force anything on anybody. I want to make sure they're educated and informed appropriately to make those healthier choices. And ultimately, as I talk about that next generation of hopefully making healthier choices, meaning they're working stable jobs, they're working longevity jobs, careers, hopefully for your hospitals, because we need them, which ultimately means an improvement in that workforce participation as well. Kind of holistic in that sense. That's the way I envision it anyway.
Well, that's a great point, and that's where it is transformational. It's really changing how we deliver care and look at things in the future. We have time for one last one.
Yeah, very, very quickly, I just want to thank the House and definitely, I know it's come to the Senate in protecting our healthcare workers related to violence. I mean, we're dealing with that every day, every moment. Thanks for your advocacy and thank you as it comes up in front of the Senate. It's a very major issue for us for the group today, so thank you.
With that, I'm going to wrap up one last question. I'm a firm believer, a lot of times when people think about the legislative process, they think about the 60-day session. They think the elected officials were only focused on these issues for 60 days. That is so far from the truth, because you heard both of them investing a lot of time over the summer. So what I would like to know, you're both legislators at Consumes full-time. You both have full-time jobs. Your family members, I mean, Delegate Royal, dad of 8 kids. So Senator Helton, first, can you know, how do you balance being a legislator, a businessman, and a family?
And honestly, it's a tough balance, but it's worth the work. And particularly, being in the health committee, again, I had President Smith call me and say, hey, we need you to run health. And so that was a new experience for me. At the same time, I've spent the last year, I had a select committee the year before that focused on substance use and mental health disorders. So I sort of had a year to run the gambit and get things figured out. It's difficult, and as we all know, in the health committee, there's a number of things that come through related to the MCOs, the hospitals, the behavioral healthcare centers, our drug treatment programs, our MAHA programs, all these things that are on the board that you sort of look at, and then you say, okay, well, our state's really burning down right now with CPS issues, and so how do we prioritize that and balance all that? And so I think a lot of times, when it comes legislatively trying to figure, and I'm not exactly answering your question, but I just want to say this, legislatively trying to figure it out, what really matters and what really gets us across the finish line. Because a lot of these things we do up here, we treat symptoms a lot, and as government, we try to treat the symptom, and as medical providers, you do the same thing. But a lot of times we need to go and take the medicine and deal with the real issue, the underlying issue that's causing those symptoms. And I think right now in our state, our addiction issues are the root cause of so many of our problems. It's really the disease, and you guys are dealing with so many of the symptoms, and in a lot of cases, it's out of your control. And so until we stop that volume of people that are coming into our CPS system, our healthcare systems, and especially when we're talking about involuntary commitments, those types of things, until we slow that volume down a little bit, we're going to continue to struggle in a lot of these areas. So I have spent this guy right here, I'm telling you, he is a great trainer, a great educator on the subject. And so I've relied a lot on the chairman here. All you guys have been great to get me up to speed. I tell you, I get the medical meeting, everybody's throwing all these acronyms out, like OTPs and PPOs and PVCs and all these things. But I honestly, I've got to speed a lot of that, and we're starting to figure it out. And that's why I really welcome you guys to continue to help me help you. So as we deal with relationship with MCOs, or we deal with the PVCs, PCBs, when we deal with all these different organizations out there, that we'll work together to get the right solution. At the end of the day, we want West Virginians to have better health care. We want them to have access. We don't want you to be limited to get to patients and provide them the best health care. And I recognize the value of all these groups and manage our costs. So we all got to play in the same sandbox and work together. And so my balance right now is just getting a little home time, but really right now I feel like it's important for the state that I learned this, and we work together and we try to get the best product across the finish line for our taxpayers.
Well, that's a tough act to follow. As Jim said, I do have 8 children, 6 of them 12 and under. So first off, an amazing wife who does a beautiful job of taking care of our children. I couldn't do this if it weren't for her. I also have the fortunate experience being able to drive back and forth to work every day. So every night I leave this bubble and I go home and put a 3, 5, and 7-year-old to bed every night. And that really sets the stage, right, for what I'm doing. But it also reminds me of why I'm doing this and who I'm doing it for, which is my kids, and ultimately transition to your kids and the next generation on how we want West Virginia to look in the future. So it is a tough balance sometimes, especially during session, but we make it work, and it's important to make it work. I care deeply about trying to improve, the outcomes that we talked about today, and so it's very important to make that work. But obviously, the other thing, as I talked about, I do travel to clients' homes throughout the state, and so I see firsthand some of the rural communities, some of the different areas throughout the entire state. What are people facing that can't even get to their hospital, can't even get to a PCP to see you, and it helps me think of ideas on how we can truly transform health in our state, and why it's so important for us to try to look at that, because, as I said before, we have that high government payer mix that we need to try to help diversify, as well as people who just need care, that need sick care. But if we can help inform and educate them appropriately, we want that to be healthy care, right? Healthy care instead of sick care.
Thank you. Well, that's going to wrap up our legislative panel this morning. One thing I want to note is, again, Both chairmen have been absolutely wonderful to work with. They have a very open door policy. We may not always agree, as we noted, but 90% of the things we do agree on, and we work very closely with them in advancing healthcare across West Virginia. Please join me in thanking them for their time this morning. Before we wrap up, a couple of housekeeping items for this morning. First, our hospital day at Capitol will take place starting at 9 a.m. So hopefully you schedule time with your legislators to meet with them throughout the day. Floor sessions, both the House and the Senate, are 11 o'clock. Please note that the Senate will have a resolution celebrating Hospital Day, followed by, after the floor session, Senator Helton has arranged for us to take a photo on the Senate floor. So if you're in the Senate gallery after the floor session, come on down, we'll do a quick photo. Also, I'd like to mention that the association will have a table over in the rotunda. So if you have any questions throughout the day, need anything from the staff, please stop by and we'll help facilitate that. Also, in your packets, there is a schedule of today's activities. A couple things to note. As Senator Helton noted, 1 o'clock is the Senate Health Committee, where they do have two bills related to involuntary holds in the pilot program on the agenda, as well as a DPP bill for a specific hospital, either in Clarksville that he noted. In your packet, it says 3 o'clock House Health. Please note it is 3:30 in House Health. And there are several bills, including House Bill 5086, which is a peer-to-peer bill that they just heard the other day, so that'll be marked up today, as well as several child care issues. Also, we will have lunch available here, boxed lunch from 11 to 1 o'clock here. And with that, that wraps up our legislative breakfast, so I greatly appreciate your time. If you need anything,